Well, COVID-19 has ravaged so many communities, but who are some of the groups that might not be talked about in the mainstream? Those answers and more with Ticker Talks starting right now. Hello and welcome to Ticker Talks, and together with Polaron Language Services, we're looking to use language to connect communities. And while Polaron is the sponsor of our program, all views and opinions in the following program are of course our own and those of our guests as well. I would also like to acknowledge that this segment is being held on the traditional lands of the Wurundjeri Woi-wurrung people and pay my respect to elders both past, present and future as well. Today I am joined by Director of Polaron Language Services, Eva Hussein. Eva, lovely to see you. What's been happening at Polaron?
Thank you, Holly, and thank you for stepping into Mike's shoes. Look, a lot's been happening and we've been doing a lot of very, very interesting translations, but one of the projects I wanted to showcase today is called You're Not Alone. It was an initiative that we worked on into Punjabi and Dari were the two languages, where we focused on, gender equality for women that were affected by COVID. And you're seeing those screenshots on the screen there. And it was a fantastic project that enabled more people, more women from diverse communities to access information that they need, that we all need right now.
Yeah, remarkable. And what about the miscommunication of the week? What have we seen out there?
Yeah, look, there's lots of it out there, and some of it is a little bit annoying for me personally, who comes from a refugee background, because some local government areas are picked on, or like even this morning I've seen some posts on social media saying, oh, city of Casey, is rife with COVID, and people try and understand why that might be so. So there was an article in The Guardian just a couple of days ago explaining that it's nothing to do with people's behaviour or people's ethnicity or language they speak. It is to do with lack of information that some communities aren't getting. So shows like today, showcase why it's really, really important to produce information in a way that people understand and can easily access.
Yeah, remarkable. Let's get right into it then, to our main discussion for today. And in Victoria, women from migrant and refugee backgrounds have been made particularly vulnerable to the virus and its consequences, as well as the COVID-19 pandemic has exacerbated ongoing disadvantages as well. Now, however, women's health services have played a leading role in supporting the health information needs of migrant and refugee communities in Australia during the pandemic through best practices as well, such as multilingual health education. So, for more on this, joining us today to discuss this are three amazing health educators who have been involved in the workforce of Multilingual Health Educators Project, or Women Project for short. Our guests today are Dr. Regina QUIAZON, who is the Research Advocacy and Policy Manager at Multicultural Centre for Women's Health. Now, she has a PhD in Cultural Studies and over 20 years experience working in gender and diversity as a project manager, researcher and educator as well. Trishula Nagarajan is the Community Engagement Coordinator at Women's Health in the Southeast, along with a team of bilingual health educators. She provides health information, health promotion and education to female, migrant and refugee communities. Farhat Kazi is a Community Engagement Officer at Women's Health in the Southeast as well, where she works as a health educator for the Women Project. Welcome to you all. Thank you so much for all of your time.
Thank you. Thanks for having us.
It's lovely to have all of you here joining us. I know Eva is really excited about today as well. Trishula, let's start with you. Women's Health in the Southeast are a part of the Women Project. What is this project and how does it support multicultural communities?
Yeah, thanks for asking, Holly. So the Women Project was funded by the Working for Victoria grant, and it's a joint initiative of the Multicultural Centre for Women's Health, MCWH, Gender Equity Victoria, GenVic, and 10 Victorian Women's Health Services, WISE being incredibly privileged to be on board as one of them. The project entailed running an in-depth analysis of the impact that the pandemic has had on migrant and refugee women in Victoria. I'm sure Regina will be able to speak to this in a little bit more detail, but it goes without saying that the data has only confirmed that women of migrant and refugee backgrounds in Victoria have been particularly vulnerable and impacted by this virus, whether it's their livelihoods or mental health or, actually contracting the virus itself. So in response to this, the Women Workforce or project employed 50 bilingual migrant women, all of which received extensive training under MCWH to become qualified bilingual health educators. So that includes, very fortunately, Farhat and myself as two of the many. The Women Workforce went on to carry out this incredibly important work in health promotion, running health education sessions, all aimed at disseminating COVID-19 health information to migrant and refugee women. But more importantly, it also provided them an opportunity to share their experiences and to have their needs heard, so we can do the best that we can to ensure that no one is left behind, which is the title of this report. For WISE, Women's Health in the Southeast, we have contributed to this by delivering, I believe, 18 health education sessions to almost 180 women to date. Our team comprises of 4 amazing women of the Southeast Asian background, being able to run sessions in Hindi, Punjabi, Urdu and Tamil. Our sessions have been specifically tailored to build vaccine confidence, where in our sessions we spend time, debunking common myths and culturally sensitive concerns. We talk to women about, the booking process, how to book in for a vaccination, eligibility, safety of the vaccines, all these integral factors that can be quite overwhelming for migrant and refugee women, which I'm sure Farhat will be able to speak to in a little bit more detail with the amazing work that she's been doing on the ground or virtually on the ground. So yes, that's a little bit of a snapshot
Wonderful.
of what the Women Project has been about so far.
Oh, that was the perfect synopsis, I think, as well. Remarkable work. Regina, I wanted to ask you as well. Now, your report, Getting Left Behind, Migrant and Refugees' Experiences of COVID-19, has recently come out. How has your research at the Multicultural Centre for Women's Health informed the Women Project? And I guess, what are some of the major findings of the project that you saw?
Well, I guess the Multicultural Centre for Women's Health has been conducting multilingual health education for over 40 years. So that in itself is the very rigorous evidence base that we have. We go out to communities where women work, live, study and get together, including workplaces. And we also visit women's prisons as well with the health education program. And I guess this model of health education really recognises that women are the leaders in their families and communities. They're at the front line of the family and household responsibilities, and they also manage family commitments, and they're more likely to pass on health information to family and friends. So in this regard, women are really in the best position to not only bring about behaviour change in others and in themselves, but also build other women's confidence to seek out health information and to navigate the Australian health system. So as we know, even if you're Australian born and have very good English, it is very difficult and a challenge to navigate that. So since MCWA's first health education session back in 1978, there continues to be really a growing evidence base that, peer-led participatory health education conducted in language is really the most effective way to communicate health information to women in particular and from migrant backgrounds. The project findings, that it also showed that a quarter of the women that we interviewed, they didn't think that the government messaging about COVID was very good. So there's plenty of room for improvement there. And the findings also confirm and support really that the research that we have been conducting as an organisation, that, women have told us time and time again that they prefer to receive information in their own language and that this is the most effective way to reach people who don't or can't access mainstream services and media outlets.
It's a really interesting point you make there about the communication around the COVID-19 virus and what they would be required to do. Farhat, you've been involved in the Women Project as a community engagement officer. How has the Women Project helped lessen COVID-19 vaccine hesitancy in multicultural communities? We know that that is a problem that everyone is facing at the moment.
So I would start saying with the vaccination, there has been literally so many myths these women in the community had. And if I start with one of the most common myth I heard from those women is they heard they would get their fertility would be affected if they will get this vaccination. I mean, just imagine a woman has been told that if you get the vaccination, you won't be able to conceive, you won't be able to get pregnant. And that is such an important concern. But unfortunately, a myth is not a myth unless and until you have someone to give you the counter fact. And that is where these women were lacking. There were literally no avenues to them where they could get the right information. And the only people they had around them were their own family and friends who were equally uninformed as them. So this is where we came. We provided them with the most evident and research-based information coming straight away from ATAGI, TGA, Health Department. And the language used there is often very complicated. So we broke down that information in an easier way that is easily understandable to them. And our after session data shows that women went out feeling more confident. A lot of women did call us and they told us they've got vaccinated and their myths have been answered. And that was such a content feeling for us.
Yeah, thank you for sharing that. And Trishula, last question before we do have to wrap things up. These shows always go so quickly. There's so many things that we need to cover. But I wanted to ask you to finish things up. Why is it so important that everyone has access to multilingual health educators and translated health resources at the moment?
Wow, it's such an important question, and I just don't know how to summarize that so quickly. I mean, I think over the course of our session today, both Farhat and Regina have hit on some really important points. But I'll really quickly and simply close it by saying that I think multilingual health education and translated resources is just so important to ensure that the information is accessible to women, and simply for migrant and refugee communities to not be left behind.
Oh, that is a wonderful summary. Thank you all so much for coming on to speak about this. Such an important conversation. Lovely to see you all. Thank you so much.
Thank you.
Thank you so much.
Thank you.
And Eva, I just wanted to ask, would you like to summarise what we've spoken about today for us?
Sure, just very briefly, because all three panelists have said it all. Power to the women. Holly, we are the actual bosses of society, if you like, but in all seriousness, I think empowering communities with the right information, accessible in the right way, that dispel myths and produce better health outcomes is what the entire society should work towards. Because by women missing out, the on-flow effect is massive, because they do, they're the conduit often of information into a family. So I think our presenters have said it all, but I would just support every single thing they've said, and I just feel very privileged to be among such amazing women. And yourself.
Likewise, and I feel very privileged to have stepped up in Mike's big shoes today and to experience this chat today as well. Thank you to everyone today. Now, if you do have any questions about how to reach your multicultural audiences, you can get in touch with the team at Polaron. The contact details are on the screen now. My name's Holly Stearns. Thank you so much for your company.